August is National Hair Loss Awareness Month, and if you're battling hair loss, you are not alone. In fact, it affects millions of people, and the pandemic also might have made things worse. Here to talk more about it is Dr. Wendel, the founder and medical director of Medi Tresse, a female-specific hair loss center. Hi, doctor. How are you doing?
I'm good, thank you. How are you?
I am good. So let's talk about some of the things that can cause hair loss for women just in the first place.
Well, hair loss in women is actually very common. Most women don't realize that up to 50% of women are going to have some element of hair loss at some point in their lives. Most commonly, we see a lot of genetic hair loss. Up to 30 to 40% of women will have genetic hair loss and can be inherited from either side of their family, their mothers or their fathers. There's also something called telogen effluvium, which is excessive shedding, which can be caused from hormonal changes like pregnancy, thyroid disorders. There's also nutritional issues like protein deficiencies, iron decreases, and also stress, both physical and emotional stress. Hair loss can also occur as a result of what we do to our hair, harsh hair care practices like tight braids, weaves, over-processing too many chemicals. So the chemical issue is an increasing one that we see more frequently.
Yeah, and speaking of stress, your business has seen a big spike in women experiencing hair loss due to the pandemic. Yes. How are these current events contributing to the increase of more women losing their hair?
Yes, we're seeing just a huge influx of women coming in. Women who actually get COVID many of them will experience hair loss, and we've seen that on programs with some of the movie stars have talked about it. Just being significantly ill can cause hair to shed excessively. Also, just the stress that we're all under can cause excessive shedding. The good news, most of the time, shedding due to stress, whether it's physical or emotional, will recover, although there are things that can be done to help it recover faster.
And that's our next question. Most importantly, what can we do about it? And what are you telling your clients?
We're telling our clients that there's a lot that can be done, but it's important to show up and talk to the doctor, see a hair care specialist. There are topical treatments like minoxidil, but there are other ones as well. There are supplements, there's laser therapy, PRP, platelet-rich plasma therapies. A lot of those treatments can work for a lot of these different types of problems. And here at Medi Tresse, we individualize the treatment based on what the problems are.
So is there anything that people can do now or should be doing to try and prevent hair loss?
There's a lot that we can do because there's a lot that we do, unfortunately, that hurts our hair. We stress good nutrition, very important that our diet be well balanced, that it be sort of an anti-inflammatory diet. Traditionally in the United States, the diet is really not particularly healthy, so we really encourage women to take a look at that as well. Supplements can be helpful if the diet is missing some important parts. So that's a big piece is the nutrition. Being gentle to your hair, keeping it healthy, using good products, hydrating it with conditioners. I would encourage anybody who does any kind of processing to their hair, have a professional do it and try to limit the chemicals as much as possible. Those chemicals can affect the hair follicle, can cause damage to the strand, but also can contribute to some permanent hair loss. So it's important to be gentle to our hair. Again, the issue of stress is so huge in our lives, even before the pandemic. But unfortunately, this pandemic is lingering on. And so try to be good to yourself. Figure out ways to diminish stress, get exercise, do some meditation, some yoga. These things are all really important for all of our general health, but also for hair. Our hair is part of our physical body, and we need to take care of it.
All right, some very sound advice from Dr. Wendel, the founder and medical director of Medi Tresse. Thank you so much for joining us today.
Thank you very much.